When a nurse comes into the home to make a visit, that can look very different for every family because every family has different needs, every patient has different needs, and we don't want to just address the physical needs of the patient, but also psychosocial, emotional, spiritual. So we realize that this is a very tender time. It's a journey, and we are coming into that special space. And so it's not an agenda that we have, it's whatever the patient and the family needs for each visit. So the nurse will come in and sit down and have a discussion with the patient and the family. They'll sit down and talk about goals of care, what kinds of things you want from our visits, what we can help with in any area, whether it be extra equipment, supplies, more visits from the nurse, visits from the social worker or the chaplain or the volunteer, or even from our nurse practitioner or the physician. So the visit should start off with just a discussion about how things have been going. Are the medications working? Are there new things that have come up since the last visit? Then the nurse will complete a physical assessment, which involves taking vital signs, listening to the heart, the lungs, the belly, checking the skin to make sure there's no problems there. And then again, kind of coming together as a group and discussing what the assessment showed. And it may require a call to our hospice physician or nurse practitioner to see if there are some other things that we can do to provide comfort or to treat certain things. Maybe there's an infection that's present. And then once those recommendations are received from the physician or the nurse practitioner, then there's another discussion with the patient and the family about the recommendations, and then a decision is made about what we want to do with those recommendations. It's always the family and the patient that decide, do you want the changes made? And then kind of wrap up the visit, make sure that there's no further needs, check the medications, make sure that they have an adequate supply, order more if that's the case, and then discuss when the next visit is going to be. The frequency of visits with patients and families varies quite a bit. Sometimes in the beginning, because we're trying to get symptoms controlled, the visits might be frequently, and it just depends on what your needs are. Then they may space out a little bit and just be once a week, but just to know that if anything comes up and changes, we will change our visit frequency to meet your needs, whatever that is. And we highly encourage our patients and families to call if there's any questions, any concerns, any changes, because the sooner we can come in and address something, the quicker the patient will be more comfortable and the more confident the family and the friends will be. So if a patient needs something at night or on the weekend or a holiday, all they have to do is call the hospice number that we give every family a magnet. It has all of our contact information on it. We manage pain, shortness of breath, anxiety, decrease in appetite, constipation, wounds, infections, whatever might come up, we're going to tackle it, and we're going to make sure that it's taken care of in the home situation where you're comfortable, where you've developed a trusting relationship with your nurse and the other caregivers that come in. And our big desire is for you to be in your home with your family and your friends, having the best quality of life that you can have for as many days as we're given.